Happy Friday, and thank you for joining us. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is for all of those who are finding creative ways to connect with one another and support each other. Just this week, our mayor's office expanded Wi-Fi testing and Wi-Fi accessibility in our senior center parking lots to increase the opportunity for people to connect to each other. Our library system has a multitude of online resources for people to take advantage of, especially when so many people are staying home and need opportunities for entertainment and continued learning. And here at KCHD, I want to thank our team for so quickly expanding our testing capacity, so on Monday we can open up testing for the public without appointments. Our staff completely redesigned the system and moved our testing location to make it more accessible and safer for our community. The emergency preparedness and our clinical leadership team did a Herculean amount of work to make this happen, to completely shift our operations, and we are very grateful for their flexibility to make that happen. We sincerely appreciate the Knox County Mayor's Office for supporting us by funding the expanded testing to make this all possible. We also want to thank Knox County Engineering and Public Works for providing us the testing site, and our Knox County IT department for facilitating all of our technology needs that come with setting up a remote testing site like this. Now for some details on the testing. Beginning Monday, KCHD will test people at the Knox County Engineering and Public Works building from 8 a.m. to 3 p.m. This testing will be done on a drive-through model. However, if transportation is a problem, you can call our phone bank at 865-215-5555 to discuss an alternate testing option. We do expect the volume to be very, very high these first couple of days, so we urge people to please be patient as we test as many people as we can. We are really encouraged that we were able to get the supplies, the PPE, the testing kits to expand our testing. And we will continue to work to secure more supplies, as it is our desire to continue this level of testing. Again, we just ask that people be patient as they go into this. There's going to be a lot of people. We're already getting a lot of calls with people wanting to get this testing on Monday. Know that this is going to be going Monday through Friday. Also, if you're a contact and you think you've been exposed directly to a case, we'll be reaching out to you. But if you want to get tested, we suggest you wait 5 to 7 days from the last time that you were in touch or in contact with the person that was the case. That'll give plenty of time to make sure that you have the best chances of having accurate test results. So that's really important, and that can help spread out the crowds a little bit beginning next week. For people who would like to be tested this weekend, there are a variety of testing options available in the region. The East Tennessee Regional Health Office is coordinating testing at Smoky Stadium on Saturday from 9 a.m. to 4 p.m. in Sevier County. And on Sunday, they are coordinating testing at Roane State Community College in Roane County, also from 9 a.m. to 4 p.m. You don't have to be a resident of Sevier or Roane County to be tested. And there's also a lot of other options for testing in the regional county health offices over the weekend. And you can look at the Tennessee Department of Health website for more information on those as well. For other testing options in Knox County, we have worked alongside KGIS to create an interactive map on our website. We'd like to take a few minutes to show you how to access this map. We ready? Okay, first, you go to our main COVID page at covid.knoxcountytn.gov. Then move to the blue navigation bar at the top of the page. Click the section that says COVID-19 testing sites. From there, you will see locations in Knox County who are performing COVID testing. We are continuously updating this page with clinic hours and testing information as they become available. We are grateful to KGIS working to provide this resource to our community. Now we'll move to our local situation. As of today, we have 189 confirmed cases of COVID-19 in Knox County. 144 of those have recovered. 22 people have been hospitalized at some point in their illness, and we are happy to report that no additional people have died due to complications from COVID-19. And with that, we'll open it up for questions.
All right, if you have any questions, please go ahead and submit them now. All right, from the Compass, how many days worth of testing supplies are on hand? And do you expect to see a spike in positive test results due to expanded testing?
So we believe that we have enough testing supplies to last through this week and next week, and we're going to continue to work to procure more supplies so we can, like I said, continue this level of testing for as long as we possibly can. With expanded testing, we absolutely expect to see an increase in cases that go along with that. That's a good thing, and that allows us to very quickly identify those people and then do all the things we've been talking about doing. So we talk to them about their contacts. We ask their contacts to start quarantining and staying away from people and doing all the things that we can do to help limit the spread of disease in our community.
From the Sentinel, in respect to testing, what is the goal and how many tests are needed to have the data you need to make those decisions about reopening things? Is it a specific number?
The number really is being looked at and debated at all levels of government, from public health and policymakers. There's not a magic number right now for that. But what we need to be able to do is what I just said. We need to be able to rapidly diagnose people that have COVID-19 and make sure that they know all the things they need to do to protect themselves and their family members and their friends, and then be able to reach out to their contacts. And then we want to be able to test contacts and so forth. That really helps us wrap our arms around what's happening in our community in a better way than we've been able to with limited testing capacity.
From WBIR, where did the supplies come from for them to be able to increase testing capacity so widely?
There's a lot of different ways the supplies have been coming in. So we've gotten supplies from the Tennessee Department of Health, as far as testing kits and things of that nature. We have gotten things from the Strategic National Stockpile. So that's federal supplies of personal protective equipment that have come in to help support that. We've been able to purchase different supplies and had the support of the county to do that. We're very grateful for that. And then we've had donations for different things as well from different groups. So there's a lot of different things that have come in to be able to allow us to get to this point.
The Sentinel says, can you give the address to the testing center that's opening? And for that, we are sending out a news release just after this with the address. I'm sorry, this is Kelsey off the screen, but we'll be sending that out momentarily after this media briefing.
So there's your answer. It's coming.
Yeah, on the way. From the Compass, why aren't there any test sites east of the Broadway/Chapman Highway line?
Are we talking, can you expand in Knox County or in the region, or?
Is he looking at the map?
Oh, yeah. We're looking at the map.
If you can expand on what you're referencing there, we'd be happy to answer. From WBIR, up until now, have you had to turn people away for tests, and how many?
We have not been turning people away from tests up until now, but we had a different testing criteria. So we had, because of the limited supply, we were only testing people who met a clinical criteria to be tested. Right now, we are able to offer testing to people that don't have symptoms that want to get tested as well.
Also from WBIR, people are getting tired of staying at home. They want to see the governor reopen the economy. Can you explain why it's so important that we continue? Will we lose our progress if we just go back to the way things were too quickly?
Yeah, I think it's really important that we continue to be diligent and we continue to follow the order that's there now, and that we continue to practice all the social distancing that we've been talking about. We don't want to stop doing that at this point because we don't want to backtrack. We want to be able to re-enter and reopen the economy in a really thoughtful way that can help protect our citizens and our community so that we can all be safe while getting back to work. And that's really important that we, at this point, we really commit ourselves, and people that are doing it, we're so grateful for, and we encourage you to continue doing that. Commit ourselves to staying at home unless you have to go out, and making sure you're following all those parameters, staying 6 feet away from people and wearing masks and washing your hands frequently when you do have to go out.
Also from WBIR, they say there's a lot of people comparing the coronavirus to other diseases, asking why bother taking this so seriously if fewer people are dying. Now in the United States, daily average coronavirus deaths are outpacing the top 15 diseases in the United States. Can you speak to that?
I think goes back to what Dr. Buchanan's talked about a lot, that this is a new infection, and it's really contagious, and we're all susceptible to it. And that's what makes it different from all of the other diseases that we talk about when we have vaccines, or we've seen them before and we have some immunity to them. Everybody is at risk of being able to get this disease, and then who gets complications from it. That can go up with more people that have the disease. And so we want to limit that as much as possible.
They also asked, the Tennessee Health Commissioner said antibody testing will be a game changer. Do you know if and when that testing will be available in Knox County?
It really will be once we get to a point where we can utilize it and there's more science behind it, and that we're more confident in the accuracy of the antibody testing that's out there right now. And we're really looking into that. Across the board, folks are looking into this to be able to give us some more data for how we respond to this and what's in the community. But right now, that's really being looked at a higher level.
From the Sentinel, Vanderbilt University released their latest data on COVID-19 Thursday, and the Knoxville region looks better than nearly any other place in the state. However, it was accompanied with a warning, quote, "In the region around Knoxville, the transmission rate is believed to be at 1 or below, but researchers are not confident in this measurement due to limited data on virus testing in cases," end quote. I don't know if there was a question in that. If Tyler, if you don't mind submitting your question, it might have just gotten cut off. I don't see the question, but we'll come back to that. From WBIR, where are we on the curve? If this was a marathon, what mile are we on?
The marathon question, again, it's always such a good question. We are continuing to increase every day. And I think until we start seeing that decrease happening, we're still on the front half of that marathon. Where we are, exactly what mile, I can't say. But I think that we're seeing encouraging news. The Vanderbilt report is encouraging. And again, that goes to our community and what they're doing to really follow the order and stay at home. But we also, the other side that goes with the warning from that report is we want to expand testing. So we know that we can be more confident in what's happening in our community, and working to do that every day. Also, just to point out, I don't think we've said this in a while, but we're not the only ones doing testing. And so we want to encourage and continue to encourage providers to do testing, and you seek care with your provider if you're sick, because you really need that full assessment. But they can really help, and with our hospitals and the testing we do, to help give a better picture of where we are right now.
From the Sentinel's question in regards to the Vanderbilt data, if you were just looking for a comment, would you like me to repeat that for you?
I mean, I think I probably just hit it with the Vanderbilt data. It's encouraging, but we do, I agree with what the warning was, that we need to do more testing. And that's really where we are today, talking about how we're expanding. And we want to encourage others to continue it, to expand their testing as they're able as well.
From the Compass, it says, this is in regards to their previous question. The map shows no test sites in East Knoxville or East Knox County. I understand the city and advocacy groups have asked to have test sites in East Knoxville.
Okay, thank you. So yes, one of the things, first of all, for the map, if people know of testing locations, if you're a provider that's providing testing, a walk-in clinic in that area, please let us know and we'll get your information on our website, because we might not be aware of that. Additionally, we are looking at doing a testing site in East Knoxville as well. We do realize there's been gaps there, and hopefully we'll have information on that in the very near future, but that is our next location that we want to go.
From WBIR, just because we may be flattening the curve doesn't mean we should let our guard down. Why is that important?
So no, we don't want to let our guard down. It's really important. I think it's Dr. Fauci said you want to keep your foot on the gas with this right now. And that's, again, because we want to keep that curve flat. We don't want to spike. And so if we open up too quickly, and if everybody starts interacting too quickly, we're going to be spreading the virus more quickly, and we're going to get more cases, and we're going to spike up. And that's when we have trouble handling it on the medical side of things with our healthcare system. So we really want to encourage everybody to still follow the order, maintain social distancing if you have to go out, wash your hands, avoid sick people, all of those important things. It's very important that we keep doing that, and we'll keep having these encouraging signs if we do.
From WBIR, you said you were expanding maximum capacity to 90 tests per day this week. How many on average have you been administering each day?
So I think we're at about 60 right now. And one of the reasons that we moved our testing site to Knox County Engineering and Public Works is that we realized that there were traffic issues in the area that we had been before. And so we wanted to get to a place that we could more safely have more people come in to get testing. So we think our new location there, we're going to be able to get a lot more people in more safely.
Their follow-up is based on supplies. How many people will you be able to test next week?
I think we're going to have to see how this plays out, really. We're prepared to test. We've been saying 90 to 100 a day. And I think we're going to see how that new model works. We haven't been there yet to really be able to see what the flow looks like.
Another question from WBIR. They say Oak Ridge had to restrict their testing criteria to CDC guidelines after an overwhelming response. Can you explain whether you think that will happen here, and have you had to turn people away?
We haven't had to turn people away from the Monday situation because we're just moving to that at this point. So I think that we feel confident in the amount of supplies we have for next week with the flow that we think that we can have. But I think it's going to take seeing how many people are coming in and how fast we're turning them through with all of the setup that we have to be able to have a better idea. I think probably Monday after the first day, we'll have a better idea of what that looks like.
Another question from WBIR. One of the criteria set forth by the White House is robust testing for healthcare workers and in general, flat or increasing testing volume. How would you grade our testing numbers in Knox County right now, A to F, and why?
Oh, that's a tough one. I think we can definitely be doing better. We've been saying that from the beginning, and that's really been an issue with for a lot of things, getting the testing supplies and having the PPE and the lab capacity. All of those things play a role. But I think that that we're improving every day, and that we're seeing that we're obviously able to open up testing in the way that we're doing right now. We do want to make sure that healthcare workers are able to get tested and get back to work as soon as possible. That's critical. But a grade, that's a really hard one. I'm going to go probably maybe a C right now.
Another question they have is another criteria mentioned is emerging antibody testing. Are there any plans for that coming to Knox County?
Definitely looking forward to being able to get to a point where we can routinely use antibody testing. But right now, guidance from CDC and the state and World Health Organization is that we're cautious with those results at this point. And we really encourage the PCR testing. It's what we've been doing as kind of the gold standard testing right now, but very much looking forward to more data, more information, and being able to more readily utilize the antibody testing in the near future.
From the Compass, what will be the importance of data from contact tracing and making recommendations for reopening the economy?
I think that contact tracing is a big one right now. As I think Dr. Buchanan mentioned last week, we're getting an average of 4 to 5 contacts per case. That's a really low number. We do contact tracing all the time with different diseases, and that's a really small amount of people, which really, again, goes to how well our community is doing with following the order and maintaining social distancing. As that number grows, as more people are interacting, then the contacts are going to interact. And so when we start seeing a lot of cases come out of contacts moving forward, that's when we'll have to have discussions with our leaders on, do we need to slow down our opening or revisit how we're doing things if we start seeing a lot of cases come out of contacts when we move forward.
I believe you touched on it there, Charity, but their follow-up question was, do you have an estimate on the number of people beyond those who tested positive who have been contacted during the contact tracing process?
Yeah, I mean, it's 4 to 5 per case on average. So, you can do the math there, several hundred contacts that we've been in touch with.
If there are any additional questions, please go ahead and submit them into the chat feature now.
Can you clarify those were contacts and not all positives, those 4 to 5?
Oh yeah, the 4 to 5 contacts per case. Thank you. Wanted me to clarify. That doesn't mean that there's been 4 to 5 new cases from each case. We're just reaching out to 4 to 5 people they've been in contact with on average.
Any other questions? Okay, well, thank you all. We appreciate you joining us, and we hope everyone has a great and safe rest of the day and this weekend.